All right. Good morning, everyone. Thank you for coming. I'm going to get started here, sharing my screen. I'll be presenting today on accessing Brazil's public health database. Let me see if I can present mode. And then I want to see if you guys can see my screen. Yes, should be good. All right. So thank you all for coming. We are having this also broadcasted on YouTube and recorded. So if you know of anyone that was not able to join or you wanted to share this later, you can always do. Um, for those who don't know me, my name is João Vitor Pérez de Souza. I'm currently a postdoc with the Duke University Department of Emergency Medicine, but also working at the Gemini Research Center and at the Division of Translational Health Sciences. Today, I wanted to bring this topic because it's something that comes up pretty commonly in our group. We One of our big research partners at Gemini is folks at Brazil, both in Maranhão, in Paraná, in Amazonas states, and their respective universities. And it is quite common that we do research using data coming from the public health system in Brazil. So this could be a good primer or a good small tutorial for folks who want to get access to this data, or at least understanding how it works. Before I start, I wanted to just apologize for non-Portuguese speaking folks. Unfortunately, most of these resources do not have a translation in place for English, or if they do, it's quite limited. Um, Luckily, you can get away pretty easily by using Google Translate or even ChatGPT these days by taking a screenshot of the tool and asking um, what is written there so you can understand. But I'll go slowly and walk you through. Before we start, I wanted to share some background on what the health system is and what the data system is. So Brazil is a pretty big country. As you can see, called a continental country. We have about 220 million people as of the last census. And Brazil has this unique and public universal health system called the Sistema Único de Saúde, or SUS for the Portuguese acronym. Or if you wanted to translate that, would be Unified Health System. SUS is actually the largest government-run public health system in the world because it covers virtually 100% of the population, which is, as I told you, more than 200 million people. Through the research that I did, we can also cite that it is the only country with more than 200 million people that has such a big universal public health system. We can always think about like countries that are famous for the health system, such as the UK, for instance. But it's in terms of population and in land coverage, it's much smaller than SUS. It has more than 36,000 primary care facilities, which is our Unidade Básica de Saúde, which is distributed across the more than 5,500 municipalities and then 27 states. The public health system also covers or houses, I want to say, 67% of all hospital beds in the country. And even the hospitals that are from private institutions, they are connected to the network and provide the information for hospitalization, diagnoses, treatments, and all that kind of stuff. With such a large coverage for the country and the number of facilities, you can think about how much data is actually produced from these interactions. And in fact, it's actually quite a lot of data, just to say briefly here. I'll give you some examples on what the data is and what kind of data is shared. But essentially, Brazil has a law of, I'm not sure how to translate this perfectly to English, but like public access to data. that most of these data sets, they are made public for everyone to use. They're just de-identified. But you can even request specific data points for government institutions, government officials, because there's this law. You can do this request, and it's mandatory for them to give them this access, even though it might take a while. There's a bunch of paperwork, but because of these policy, yeah, you can get access to a different data sets than what actually is available. So the DataSUS is the data system or systems that represent or capture the information from all of this infrastructure in the country. It was created officially in 1991. And in terms of health system, the first health system ever created was the mortality system, but that was established, I think, in the 1970s, and was the first database that actually moved from paper to digital once the DataSUS was created. We have more than 45 health information systems available, and I say more than 45 because there is some conflicts on the definition on what the data system is. But you could even find reviews or systematic reviews that actually cite 300 data systems. But I try to be more conservative with the ones that are more consolidated. They have a complex governance structure regarding the health system. I apologize if this is in the wrong place, but I'll just breeze through and show. So the governance, both for the data systems, but the health system overall, is organizing in the municipality, state, and federal level, with the participation of the community, with participation from health councils, health conferences, and different committees, in a way that the priorities are distributed across the population and the governance levels. And this is a very good paper for you to review if you are interested in learning more about this policy about governance for the health system itself. It's published in the Lancet.
Bon, una message.
Then coming back for the data system, I wanted to give you a few examples. So I'll touch on 3 data systems before we go in on how to get the access. We have the mortality information system, which is I'm using the acronym in Portuguese here, so SIM. It has about 1.3 million new entries every year, which corresponds to every single death that occurs in the country. And if we would take a slice of this data just to understand how much is available, we would have 33 million total entries from 2008 to 2020. And this is just a slice that I had from a different project that I was able to pull some data to show you guys. For the live birth information system, that is also called SINASCI, it has about 2.5 million new entries. So new every birth that happens in the country is registered in the system, and we would have about 55 million total births registered for this the same slice. So I forgot to add the 2008 to 2020. And as another example, we have the health surveillance system, also called SINAN. We have more than 20 notifiable diseases that are captured and reported in the system, and with about 20 million total cases. To give you more example, I want to go into more detail about each one of these. So the first one is the mortality information system. It captures a bunch of socio-demographic characteristics such as age, gender, literacy, where the death occurred, where this person lived. We have even capturing maternal, neonatal, and stillbirth deaths, and even what was the health facility reporting this death as well. We have ICD codes, primary, secondary cases. We have investigation to confirm the causes, and much more. So it's about 150 variables for this system. And just to give you an example of a paper or application, so this is a paper that we published at Gemini with colleagues there. in 2021. So this one was measuring the influence of global crisis and the Brazilian political oscillations in the suicide rates of the country. And this used a lot of data coming from the mortality information system, just to give you an example of the research that can be done using this database. Then for the live birth information system, it captures a lot of information on the birth, on the both on the child, but also on the neonate, but also on the mother history, also on the like geolocation information for the address of the mother, the health facility, where the even if there was a home-based delivery. It captures a lot of information also on the newborn, on the like the type of delivery, the APGAR score, the weight, abnormalities, even like what professionals supported the labor or were involved. And to show you an example, this paper here was published in 2023 by having Dr. Charla Hunt as the primary author here, but used the the live birth information system to measure the impact of region, time, and income on the stillbirth and neonatal mortality in Brazil. And if you had the chance to get to know Natalie, that was one of the master students doing her master's at the Global Health Institute, she also used the same database for her thesis, which was on the C-section and normal delivery rates in Brazil. So just showing how this can be leveraged. And as the final example for the health surveillance system, this one captures, I want to say, notifiable diseases or diseases that have mandatory notification in Brazil at least. So it's more than 20 diseases. Just cite a few examples we have here: tuberculosis, leptospirosis, rubella, yellow fever, and many others. And one of them is actually pretty common in our group and pretty used in our group, which is the accidents caused by venomous animals. And here we would have snake bites, we have spider bites, we would have scorpion stings that are captured across the country. And since we're talking about snake bites, it's just showing one of the papers from that use this data set for the analysis, which is mapping the clinical management resources for snake bites and other animal envenomations in the Brazilian Amazon. And you can think about that we can even cross these systems to get more information. And for this paper specifically, they not only talk about how many cases happen in the Brazilian Amazon or the Amazonas state as a whole, but also go about how many health facilities are there, how many health facilities can actually deliver the anti-venom serum, how many, what is the size or the magnitude of the number of professionals that can actually deliver this type of care, and all of this data is available in the data systems in Brazil. So we can go and have a really ample, wide view for the data sets. I see a question from William. Is this a periodic surveillance and done after a certain time? Is it government funded because it's really sustainable data source? Yes, it is 100% government funded, William. And by this here, so the surveillance and data system, every case, every situation where a patient comes to a health unit or hospital and there is a diagnosis for tuberculosis, leptospirosis, or any of these cases are sent to the federal government. Actually, they're sent to the municipality, then to the state, and then to the federal level to be stored and organized in this database. And this is done in a way that we try to capture as much as possible from this encounter, um, instead of actually having um, like a siloed information system where, well, you were diagnosed on this municipality and information is only be kept on that municipality or that hospital or in that region. No, they try to send this across the whole spheres. So we can get this picture on the small level, on the granular level at the municipality, but also at the state and the federal level as well. Um, there are the way that the data is shared is that they usually have windows of data sharing with the government. So let's say every 3 months or so, they share the most recent data for some diseases which are, in an outbreak, like when you had for COVID-19, the data was shared like every day. So there wasn't a delay to share it. It was shared as quick as possible. But some of these, they have even like quality control inspections every 3 or 6 months to make sure that the data is in good quality. But still, it's also secondary data, so there are limitations, of course, in that sense. And then I showed you the glance on the governance structure for DataSUS. All right. So after having this introduction done, I wanted to move on to the how to actually access this data. But before I moved on, I wanted to see if there are any more questions, maybe from what the system is, what kind of data is available. Please let me know. All right. If you have any questions, just you can leave it in the chat. You can unmute. Please do whatever works for you. Okay. In order for you to actually access this data systems, you actually can use a few different options. It is getting easier and easier to do these days. So that's a very good, very good advance in terms of like accessibility, even in how um, modern the systems are, how stable they are. Because in previous when I started doing this type of research, it was really much harder to get access because of how unstable the system was. But essentially, you can use website options, you can use coding options, and you can even use the new PDD platform, which is the one I want to talk at the end. Um, Before we go about it, I guess that this is an important advice for all of these access options, which is the first one is that data source is unstable, in the sense that something might happen in these data sources, and they might be offline in the day that you want to pull this data, or maybe for some reason the specific year range that you need to pull data from is not available when you want to pull this data. There were even, unfortunately, some events in the past like 5 years or so where hackers went into the system and tried to do ransom. They held the data for asking for money or something, or even there was like the data systems were old and they had to replace them. It took a lot of time. So essentially, what I'm saying is download and save ahead of time. And luckily, these problems have become more and more rare as they have been updating the systems for more robust and stable solutions. They still use some outdated systems and outdated formats, and this is going to be a problem when you're doing data analysis. So again, download and save ahead of time, because once you have the data downloaded, you can do whatever you want. Just go back to the raw format and process again. There might be proxy connection issues. So if you are using a connection proxy like from your university, or in our case here at Duke, if you are using a Duke machine, they usually have this layer of internet security that sometimes blocks the connection between the server in Brazil and the server at Duke. So that might be a problem when you're trying to download this. So just be aware. They use these unusual data formats, so ask for help on how to decode these files. They are not standard files that you would find, like an Excel or CSV. And unfortunately, as I told you before, there's little to no translation available. So reach out to a Portuguese speaking colleague if you need help. All right. The first way of accessing the data is called TabNet. It features a website access, has a point and click option, so it's pretty easy, straightforward. Unfortunately, it does have a limited download format for the data. You basically get like a summary table out of your research. In this example, I wanted to get confirmed cases for tuberculosis in the state of São Paulo. And I wanted to do that by the year of diagnosis, by the month of diagnosis. So I can get counts for this. So this system is going to be limited because it's going to give you these like 2 by 2 tables where you can filter the data. Let's say I wanted to get only tuberculosis cases for males or females, you can do that, but it's going to be limited that it's only going to give you these 2 by 2 tables or maybe a bar plot or something. So it's going to be very limited because you're going to need to do, if you want to actually extract a bunch of different variables or a bunch of different counts stratified by age, by gender, by municipality, state, and whatnot, you're going to do this multiple times. So it's slow and repetitive. And because it's slow and repetitive, you can get into a lot of reproducibility issues. Like, let's say you forgot to click on the option that filters the data on the first time, and then you get a random number that is not actually the real number. And I wanted to show you how it works really quick. Um, this is the website. You can just type Tabnet, or I'll give you the slides later, and you can click on the link. But here you have a bunch of fields, a bunch of general topics where you can extract data from. Like, for instance, you can get on epidemiological and morbidity information. And here you have AIDS, leprosy, tuberculosis. This one is the notifiable diseases. You can choose the one that you are wanted to look at. So I chose tuberculosis in the example that I gave you. I'll select here tuberculosis since 2001. I can select a region, like I can do the whole country, or I can do state by state. So let me say I want to select the state of Amazonas, and it's going to load. And in the screen, you can actually select the variables that I told you to create a summary table. Like, I want to have on the rows, I want to have the years. On the columns, I want to have the month. And you're going to have to trust me that this is saying what I'm telling you it's saying. It's only gonna plot confirmed tuberculosis cases, and I want from 2024 all the way to 2014. You could even go into more detail, and as I said, like you can select by age, by race, sex, and all of that kind of stuff. But essentially, it's only gonna give you this summary table. This is very good if you want to have like a simple abstract or maybe a simple pilot data analysis, like, hey, how many cases we have in this city, how many cases we have since 2020, 2010 or something, but it is very limited in that sense. Um, And then this is the simpler, the easiest one and most friendly for people that don't know how to use data systems as much or don't know how to do a lot of coding as well. Um, the second option is called Open DataSUS. The Open DataSUS is an initiative that began to share these data files with the community in a separate website where they have a lot more metadata available for the data sets. It is also website access. It's also point and click. The good thing is that you can have full data download options where instead of actually having just summary tables, you have the whole data system available, which is pretty cool. Um, and there is some English translation available. not really much. As you can see here, this is supposed to be an example of a translated website that I requested. And the only thing that is translated is the button. So yeah, not really translated. And you can actually find a lot of information here. Like you can come into the website. They give you this view of the main data sets that you have for this, for instance, for arboviroses, like Zika virus and dengue virus. But you can even go here and type, let's say, I want, let's say weather. Yeah, weather doesn't work. Let's try the Portuguese version. Nope, nope, no. Yeah, so like if you type dengue, which is the virus, you can actually find some information, for instance, for dengue virus notification, chikungunya virus notification because it's related to the vector, Zika virus. And if you open any of these, you're actually able to look into more like metadata information on how the data is collected, which is good, but it's only in Portuguese. You have the data dictionary here. You have the data sets by year. So like 2025, 2024, et cetera, et cetera. So that's pretty good. And you have multiple formats as well. Not only the CSV, which is the standard Excel or spreadsheet format, but also JSON and XML files if you are using some sort of different analysis. And Edwin, I see your question about the English version. So if you click here, so this is now in Portuguese, you can see how it says explorar, right here. If I switch to English, it's gonna change to explore. That is how much translation it is available. The rest is all in Portuguese. So they're still working on the translation, and I hope to get that they get a better translated version, like a full translated data set or website for folks to be able to leverage data.
Okay, thanks,
Uh,
Joao.
of course. And then we are with this one, we then move into the coding access options. There are a few options if you are doing a data analysis in R, in Python, or even in some other languages. But all in all, what these coding solutions do is that they connect to the file transfer server or via file transfer protocol, so FTP, if anyone has heard of it. They connect directly to the server in Brazil and download it for you. And the way that they try to do this is try to wrap it up so it works. It is a little easier for the user to do this in R or in Python than to actually go into the terminal and log in and search for the files, which is a bit messy. But you could do that as well. The one that is the most famous, the most used by the community in Brazil and for research overall is called Micro DataSUS. So Micro DataSUS. It is an R package, but there are, as I told you, there are examples for other languages as well. Um, the things to consider is that you need some R coding skills, but it's pretty simple actually. So if you look here on the right, this is the code that you would use to get data from the live birth system from 2021 for the state of Acre, which is one of the states in Brazil. And just this like three or four, I want to say like one, two, three arguments of code, you could get the data set for the whole year for that state, which is pretty simple. Even though it's pretty simple, I will tell you ahead that it has terrible package dependencies. So it is really hard to install and get it going for someone that is like say a novice working in R, because specifically Brazil uses this weird data storage format that's called .dbc that isn't really used elsewhere. So because of this dependency, one of the packages is actually a problem to install. but it eventually works, right? We can get it sorted and we can get it working. Even though it has this problem, having the coding solution is great for automation and backup actually. So if you want to set this as a dashboard that is gonna every 1 month or so download the data, clean the data, and show you the most recent data, this is a very good option. Or if you want to create your own let's say you are doing a report to the Ministry of Health that you want to do every month or so, you can easily automate this using the code to download the most recent version of the data, clean, organize, and generate the report. So that's pretty good. They have a bunch of customizable download options, such as you can select the data system you want to download, if it's mortality, notification, hospital, ambulatory, all of those data systems. You can select the dates and can select the state that you want to download, so that's pretty good. And they even have functions to clean or enrich the original data set. So that is good because the data set is big and messy and disorganized sometimes. And they have already created a few functions that help you through that process. And I have the links down here for if you want to find more on how to do it. The links for the package. This one is the link for the package itself, if you want to look in the documentation. But I wanted to show you the R code just really, really quickly, in case you want to test it later. So this is the exact same example that I showed you on the slide just now. So this is the package. You would basically load your package, which is called micro DataSUS. You can then use this function called fetch DataSUS that is going to fetch the data for you. You can start the year that you're going to start your data collection, the year that you're going to end your data collection. You can select your unit of the federation, which is your state. In Brazil, and you can select the information system. This one here is the live birth system, so SINASC, like live birth. And when you run this, it's gonna connect to the system. You can see here in my message saying, my internet connection seems to be okay. DataSUS FTP service is to be up and reachable. It's starting to download. So it connects to this server location, downloads the file for you. In this case, it's a small file, only 700 kilobytes, because it's a small state and it's a single year. In small state in terms of population. You can then process this data set and get something that looks like this. And with that, you have all of the variables that the data set comprises. So we have about 16,000 entries with 75 variables. So just to give you examples, this one here means mother's age. We have here mother's education. What else? How many living children? How many children that died in the past? The municipality of residence? What was the gestational age? And so on and so forth. So you can get a lot of information in this registry, in this database, for that in the pretty easy and fast way of collecting and pulling this data. And once these solutions are I want to say these three solutions that I showed you just platform available for data collection. Download these data points and you organize all of it. In terms of features, it has a website and an app access, so you can download the actual app on your Windows machine. It has a point and click interface, so it's pretty easy as well. You can download the full data options, and it provides you DataSUS and more. So not only the data systems that I'm talking about, but also things on GIS, like maps and shape files for Brazil and the States. You can even have weather information there. You can have environmental data there. You can have um, populational surveys there, census information there. They enrich this resource with more data sets as well. And the really cool thing is also that they convert the weird DBC format that told you to the CSV, which is standard for every other data analysis pipeline. So this is a very good option if you wanna get art and take something that is not going to slow you down. Because if you want to use the first option, TabNet is repetitive. You're not going to have to do a bunch of data queries in order to get the data that you need for your project. So that's not really good. Open DataSUS could be a good solution because they have the full data systems there, but they are limited in the number of data systems that they show. The coding solution is great, but also it requires you to learn some code and to learn how to install the database to install the package, which it can be a problem. And whereas the PDD or the de-identified data platform is pretty easy to use, and I would recommend for anyone trying to download data for the first time. Just to show you how it works, you can go into their website. So this is the website, it's all in Portuguese. But you can come here in the top and say, I want to access a data set. And you can add a data set to your profile. And here you have a small form to fill where you're going to say why you want to access this data set. So um, let's say that you want to access the data set because you're doing research on climate change. So I'm going to write in Portuguese. This is just like a small, just a request. You don't need to be very specific. You don't need to share your abstract, your research aims or anything. It's just sharing a minor reason. You then select like your keywords. So in this case, I want to evaluate the impact. I am studying climate change, and I want to study interventions in health. And then here in this drop-down option, you can actually browse and select all of these data systems for you to download. So you can see how many there are, how small the thingy is here. So all of these data systems are the ones that I've been telling you about. And you can just select as many as you would want. Like, let's say for some reason, I want to study leishmaniasis with chikungunya cases, but also at understanding how many beds are available in hospitals, and I don't know, with uh, I'm not going to try to translate this, sorry, with yellow fever. Uh, just by doing so, you actually would have to have a bigger, so you have to have at least 50 characters, right? So this. So let's see. And then once you do that, you're already approved. And all of these data sets are added to your profile. Once you have them added, you can then move on to your app. So here I'm showing you the app, how it looks like. And once it's updated, sorry, you would have all of your data sets listed here. I just requested, so it's going to take like a few minutes to update, but I had a few data sets here already. So like for instance, I could select this first one, this last one, which is meningitis, and I can select the years that I want to download the data. So just for the sake of time, I'll just keep the 2007 data set, so I can download it pretty quick. Um, but you could download all of them if you think that's what you need. And then you click on download, and it's gonna run the download for me, and it's gonna save my data set in the folder that I specified. In this case, it's gonna save on my download folder. And I should have a few examples here just to show you that it works. Uh, yeah, it's downloading the meningitis file. And if you go to downloads, you can see how these files here. So all of these CSV files that I'm showing you, they are for snakebite cases, actually venomous and animals accidents, sorry, cases in Brazil, all the way from 2007 to 2024 that I downloaded previously. And you can see how they are pretty large in the number of entries. Like for instance, this one has uh, about 140 megabytes, which would be hundreds of thousands of entries for sure. Um, and we should have downloaded everything, I think. Let's see. Downloads. Yeah, so meningitis. I'll try to open it up here. Let's see if it plays out. Hmm. I don't think it's going to open, but you can see in this preview how, even though it's a little bit messy, like all of these up to this line are all variables, like TP underscore NOT, ID underscore AGRAVO. All of these are variables within the data set, and all of these data points are the actual patient information. You can see how the information was downloaded, and it's available for you to process and to analyze. And from all of the options that I've used thus far, this one here seems to be the most simple. Like you hit a button and downloads everything for you. You don't need to, code anything. It just works. And it seems to be expanding quite a lot. This platform was launched, I think it was February or March of this year, and they have been doing a great work in increasing the documentation and metadata information for you to use. It is still, of course, de-identified data. Still, you're going to run into the issues that we would have for all of the other analysis, all of the other options, because it's de-identified data. But it's a very good resource. And then just to wrap up, I wanted to talk about one thing that we want to do at Gemini, and we want to do in order to improve our reproducibility and to improve the documentation that we have for these data systems. And here I'm calling it Gemini DataSUS databases. This is just a temporary name to say that we want to have our own maintained and validated databases so people can actually use the same data files for different projects. Because the way that it works today is someone starts a new project. Let's say a new master student wants to do a study on I don't know, the mortality and morbidity related to tuberculosis in Brazil. They're going to start this new project. They're going to have to learn all of this before they are able to actually pull this data. They're going to pull this data from the system. They're going to have a hard time understanding if they are non Portuguese speaking. They're going to have a hard time translating everything. They're going to have to process data. So cleaning, missing data, renaming variables, recoding, all of that kind of stuff, maybe adding geolocation information, all of that stuff. They're going to do analysis. They're going to get the results, and that's done. We're never going to be able to use these codes or these files again because we don't have a good documentation. Don't have a good organization as well. Unfortunately, this leads to rework. So um, this person downloaded the mortality information system for a tuberculosis project. But if I want to do the same, use the same system for, I don't know, snake bite cases, mortality for snake bite cases, I often cannot use their data because it's not organized and not documented. And I have to download data again, and maybe DataSUS is offline at the time, or something happens and I cannot get data when I needed to get data. And you can imagine how it works. Of course, this leads to poor metadata in organization and reproducibility issues. It is quite common that we are analyzing the same data sets and we are using different variable names, different coding structure, which is a nightmare on its own. What we want to get to, or how we think it should be, it's a centralized resource where um, let's say a new project is started. This person learns all of it, is going to pull the data. Maybe this person reach out to me or to Marcos, to Nathan, to folks, just naming a few folks that I know that have been using DataSUS for different projects. They are going to, help them, give them advice, etc. But before we go into the analysis, processing results, we're going to do a step on documentation, thinking about mid and long-term storage and maintenance. So that next year, when the new version of DataSUS is launched for the 2025 update, we don't need to download everything back again. We just download 2025 and it's good. It is up and running. We can then proceed and work through the data. That's one thing that we want to establish. It is already in place for a few data systems that we have been using. But I just want to let you guys know of this initiative and actually invite you that the next time you plan on pulling data from DataSUS, reach out to me and let's get this started for the project for the information system that you are going to be working on. Again, we don't need to have this um, full copy of DataSource at Duke. That's not what we want. What we want to do is that for the databases that we are using, we want to be able to track what projects are using, how they are using, and to make sure that the data is of good quality. And even at some point, we do have like a cleaned version for each of these data sets that are commonly used. So the next time we wanted to do a project, we can start on analysis. We don't need to start in process or pulling or even thinking about the data. We already have it cleaned and organized. All right, so please let me know if you are planning to use some of these data, and if you want to learn more as well, just reach out to me as well. Okay. Um, Thank you all for coming. That's what I had for today. If anyone has any questions, or maybe if I went through really fast on the Portuguese names and you were confused, please, I'm open to questions. Thank you.